Greetings, Anonymous Party members. Greetings also to those of you who are considering joining the movement. For those of you watching for the first time, my name is Nick Borden, and this video is one of many in my campaign for the office of President of the United States of America. If you are unfamiliar with what I am doing and have no idea what the Anonymous Party is all about, I recommend first watching one of the introduction videos available on the website www.anonymousparty.org. This video is the fourth out of 5 in my series on healthcare reform. If you have not watched the first 3 videos on healthcare reform, I recommend doing so before watching this video or watching the 5th video. In the first 3 videos, I covered tort reform, insurance, and medical billing. In this video, I'm covering the big problem with the healthcare industry. A long time ago, the medical field was not well regulated. Sanitation regulations were lax if they existed at all. Diagnosis of disease was fairly inaccurate, largely due to medical technology. And medical training varied widely from place to place, resulting in doctors with the same level of qualifications having widely different sets of information, sometimes even to the point of being harmful rather than helpful to their patients. Something needed to be done to standardize education and regulate hospital practices so that only accurate and helpful training and standards would be utilized, and that all medical practitioners could be counted on to have fairly up-to-date and useful skills to assist their patients. It needed to be done, and rather than government involvement, it was big business that jumped in. This was possibly one of the few instances when some government involvement may have actually been the best solution to the problem. But the pharmaceutical industry stepped in and took charge. A lot of good actually came from this early on. Sanitation started to improve as training was structured to include it as an important focal point. This led to a heavy decline in infant mortality rates and a decline in many other types of hospital deaths and post-surgery infections. So, in this case, the pharmaceutical companies are the heroes, right? Let's not be too hasty. Sometimes businesses will do things that make them look good to disguise or cover up their sinister motives. In this case, it was the takeover of the medical education system that led to many of the problems that we face now. One of the major reasons the costs of medical care are so high is because of demand. Where is most of this demand coming from? Traumatic injuries, such as sports injuries, car crashes, fights, gunshot wounds, falls, or freak accidents? Would it be from flu bugs? Maybe childbirth? How about heart disease, cancer, or diabetes? Actually, between heart disease, cancer, and diabetes, that actually accounts for almost 50% of the total cost of medical services nationwide, as well as in most other developed countries. In less developed countries, they actually make up a far lower percentage of treatment. But imagine what would happen if these 3 problems just didn't exist, or at least were insignificant percentages of the total sum of all medical services. What would happen if heart disease, cancer, and diabetes were just footnotes in medical history that only occasionally surfaced in rare occasions, and even then mostly just in third world countries? This would actually be real progress, wouldn't it? In all the futuristic sci-fi movies, we see a world where doctors can keep people from actually getting sick, and mostly just spend their time treating physical injuries, or curing infectious diseases with little more than a pill or a shot, that typically have no side effects. But that's science fiction. Even in many of those movies, though, even in the ones that warned of government control, like 1984 and Fahrenheit 451, we actually see, at least minimal exposure to, advanced medical services capable of curing almost any ailment. But where are these advancements? Nearly every major advancement we have is either in diagnosis or in the treatment of traumatic injury or bodily damage. There are replacement joints, bones, skin grafts, in some cases even replacement organs, and even an amazing project I read about where doctors claim they can grow entire teeth using stem cells harvested from urine. While that last one might sound a little bit gross, which it is, it, as well as the rest of these accomplishments, are amazing. So where is this advancement in the area of cancer treatment? Where is it in the area of heart disease or diabetes? Yeah, they have drugs that treat diabetes, but none that really get rid of it. They have drugs that treat heart disease and cancer. But how effective are they? Best estimates put cure rates around 30%. But even when you look at how they come up with those figures, it kind of makes you wonder if any progress has really been made at all. How can we have the American Cancer Society raising hundreds of millions of dollars a year and have little to no progress in the last 30 years? How, in fact, is it that we now have a list of several thousand chemicals, substances, or situations like exposure to radiation that are known to cause cancer? Yet the vast majority of doctors are still largely incapable of explaining exactly what cancer is. I'm not a doctor, but I know what cancer is. It'll actually surprise most of you, and I will actually explain that in the next video of the series, as well as how to prevent and cure it. It may also shock you to know that it has been known what cancer was for over 100 years. Yet modern science has only recently, within the last 10 years, even admitted most of what was explained in 1902. Furthermore, it may shock you to know that the most effective cancer cure to date was discovered in the 1940s and is a naturally occurring substance. This makes it impossible to patent, which means not a lot of money can be made from it. So logic would suggest that if a synthetic cure, meaning entirely man-made, were produced, that it would be openly embraced and widely used, since a hefty profit could actually be made, right? Wrong again. In fact, nearly a dozen synthetic cures, each considerably more effective than what is actually in use in the accepted medicine, have been made over the last 50 years. Each has been tested and its reputation smeared by the established pharmaceutical companies and made illegal by the FDA. Why would they do this? There are two reasons. First, nearly 2 million people in this country are employed in either the research or fundraising for cancer cures. If you find a cure, then most, if not all, of these people would be instantly out of a job. I firmly believe that the vast majority of the people working in this industry are not sinister and selfish people. Most are in it because they sincerely believe that they are part of a movement to find a cure for a real problem. They're good people. I don't blame them for wanting to help. But there are at least a handful of people who are only seeing the dollar signs and who have either orchestrated or at least knowingly perpetuated this farce. I don't claim to know their names, but I'm sure that they could be found out. Unfortunately, though, they have set up a system in which everyone has a motive to ignore the cure should they discover it. Not everyone is that dishonest, but those who are honest are just smeared as unreliable, uneducated, or just overly optimistic. There's no easy exit strategy for this. The only thing I can recommend is that if you are in one of these industries, first, educate yourself. Find out all the information you can on these other cures that have been smeared. Find the articles that support the other cures, since the opposing articles are nearly all published by either the pharmaceutical companies or by research companies who are just citing the research presented by the pharmaceutical companies that want them covered up. Once you're convinced that you're working for the wrong side, then you are hopefully no longer comfortable working for them. At this point, I think it's time to start looking for a job elsewhere. The sooner you get a jump on that, the better off you're going to be. the fewer people working in that industry, the less of a horrible thing it's going to be when the cure actually does come to light and it's actually accepted the way that it should be. But if we as a nation are able to fix the healthcare industry and allow competition, that would allow real progress, wouldn't it? And the second reason that the FDA would cover up this cure, or any of these cures, is because an instant or near instant cure, even if it can be patented, cannot bring in as much money for pharmaceutical companies as something that requires frequent and repetitive treatment, like chemotherapy, radiation therapy. So what exactly is the big problem that I'm getting at, and how do we correct it? Well, here it is. The big problem is that the pharmaceutical companies play a large role in developing the educational materials of healthcare professionals. Most healthcare professionals actually spend 5 to 10 times longer learning about medications and the compatibilities between them than they do learning about nutrition. And nutrition is where the key to health actually lies. But why would pharmaceutical companies care about health? If people ate healthy, then they would be healthy, and they wouldn't need pharmaceuticals, at least not very often. An unhealthy population brings in more revenue than a healthy population. So, as long as the people aren't dying before they can spend a small fortune, then they're of more benefit to the pharmaceutical companies, that is, and to the big hospitals. And so, we have a system where we have medication after medication, and even medications to treat the side effects of other medications. How do we correct this issue, though? How do we actually fix the education of our healthcare providers? That's not extremely difficult. This is one of the very few times that you will actually hear me say this, but this situation actually calls for government intervention. But rather than mandating insurance coverage, mandating what must be covered, or spending countless of millions of dollars on websites barely outside of my own programming abilities, what should have been done is to require that since the pharmaceutical industry has a conflict of interest, that it shouldn't be allowed to participate in any way, shape, or form in producing the educational material of our medical service providers. It should publish the results of its studies and its clinical tests of its medicines, and that should all be available to doctors so that when medication is actually needed, that they have the information that they need to prescribe the right medication. But in no way should the pharmaceutical companies be allowed to influence the educating of our healthcare professionals. It should also be required that at least the primary care physicians receive an adequate amount of education in regards to nutrition. Now, it should be obvious to most people that my solution to this problem does not provide an immediate benefit to the healthcare industry. If this change was made today, and the curriculum was being prepared and ready by the time that the fall semester started for nursing students, or for all medical students, then those doctors and healthcare providers would not be entering the medical field with this training for at least 2 or 3 years, probably more like 4 or 5. Even then, it would only be the new doctors that would be fully trained in this area. Doctors of today, even if they were retrained, are already heavily influenced and therefore a little bit biased towards the pharmaceutical industry's training. And so even if they did get some of this training in nutrition, they may, at least in some cases, not be quite as reliable on the nutritional side as doctors who are trained without this bias towards medicine. If the truth about cancer, heart disease, and diabetes really came to full light in this country, and that nutritional treatments were used instead of medicines as often as possible, even if in the form of supplements prescribed by doctors, then these 3 big medical issues would nearly disappear. Once you know what causes them, it's actually pretty easy to avoid them. Granted, though, this would take several years, possibly even several decades before the big 3 were, just about gone, but This is why we also need to utilize the other solutions that I put forth in the first 3 videos in this healthcare series. But this policy, coupled with those solutions, could easily lower healthcare costs in 2 ways. First, by lowering the actual cost of services by allowing competition prompted by honest and fair pricing. And second, by reducing the amount of services needed, which was the second part which I just addressed. If you only needed to visit the doctor half as often, or just as often but only for routine checkups rather than for treatments or operations, then your costs would be far lower and your quality of life much higher. Think also about some of the indirect costs of our current healthcare system. If you're sick, injured, or terminally ill, you may not be able to work. You also may not be able to enjoy your family, your friends, your pets, property, hobbies, or whatever else it is that you enjoy. Granted, some of these things can still be done with some injuries or illnesses, but if you're busy going and getting treatments all the time, this is time away from other things that you could be doing. This is a cost to you. Your time is valuable. I know mine is. And both of our time could certainly be better spent somewhere other than at a hospital or a pharmacy line. Ideally, people would live healthy lives where they feel good to excellent at least almost all the time, and then rather than spending the last 10 to 15% of their life in and out of the hospital battling a disease, you'd only spend the last day or 2 of your life suffering at all, if even that much, and then die peacefully in your sleep. This benefits you both for that reason and because you won't be blowing your entire life savings fighting a losing battle with a disease. This either allows you to enjoy more of your savings or to leave more of it to your surviving family, friends, or whatever or whoever you wish. Now that's pretty much all for this video, but be sure to subscribe to the YouTube channel and watch for the next video in the healthcare series where I will explain cancer, heart disease, and possibly diabetes if I have time. Hard as it may be to believe, I actually believe I know the cures and or preventions for all 3 of these. I may also explain how a former oil and pharmaceutical company actually helped World War II happen, just so that they could sell more of their products. What has happened in the medical industry today is atrocious, and it needs to be exposed. And it needs to be done so that real progress can finally be allowed to bring us to where we should be. If you agree, or if you have other ideas, concerns, or questions, please go to the party's website, www.anonymousparty.org, and sign up for the web forum. There you will find discussions on this and other topics important to what I am doing, and what I hope will catch on with the rest of you who value freedom. If you do value freedom, choice, and virtue, please join us now and consider running for an office in your state. It's time to stop asking who will stand up for you and start standing up for yourself. Make your voice heard. This is your nation. You are the people.